Hello, my name is Jose Miranda Velasquez. This video is for BSN 346-04. This is a deep tendon reflex video. My model is Ms. Ruby Cairns, who is a volunteer. Do you consent to being recorded today?
My name is Ruby Cairns, and I consent to being recorded.
Okay. Well, so let's begin. So I entered the door. I entered the room, and I closed the door behind me to ensure patient privacy and perform hand hygiene. Hi, Ruby. My name is Jose. I'm going to be your nurse today. Can I check your wristband here? Please state your name, your date of birth, and medical record number.
Ruby Cairns for 2289.
Thank you. So patient sensitive information, which is perfect. I was able to verify that on the wristband. So today we're going to be performing a deep tendon reflex assessment on you, essentially. So I'm going to check your bicep, your tricep, your patellar tendon, and your Achilles. Okay. Any questions for me?
No.
Okay. So the reason why we do this is to check the motor neuron functions on your upper and lower extremities. Okay. And then this is also important to check on any patient who is pregnant or looking for signs of preeclampsia. Okay. And also, it is important to check any patient getting a medication called magnesium sulfate. This medication, we want to make sure that it is working appropriately, okay? And more than anything, making sure the medication is working effectively, okay? This is graded on a scale of 0 to 4. 0 would mean absent. 1 would be hypoactive. 2 is considered a normal. 3 is considered slightly hyperactive or even brisk. And then 4 is hyperactive with a risk for clonus. Okay. So first I'm going to check your bicep reflex here. So I would take my little hammer, and I'm going to have you just rest your arm here on your leg. I'm going to locate the bicep tendon using the pointy side of my hammer. I'm going to hit the back side of my thumb. I want to protect my patient as well. Okay. Locate the bicep tendon. Okay, there's slight movement there, which is normal, would be considered a 2. Okay, next I'm going to check your tricep. Go ahead and relax your arm. I'm going to hold it up. I'm going to locate the tendon. I'm going to use the pointy side of my hammer, and I'm going to hit the back of my thumb. Okay, I have slight movement there, which is normal, would be considered a 2. Okay, next I'm going to have you, if you can, come a little bit towards the edge of the seat here, and I'm going to have you dangle your feet down, and I'm going to check your patellar tendon here, okay? So I'm going to go down on a knee using the back side of the hammer, and I'm going to look at the kneecap, and I'm going to hit the backside of, using the backside of the hammer, hit the kneecap slightly, looking for a reaction. Okay, we have movement, which is normal, would be considered a 2. Let's see. Next, I would like to check your Achilles. Okay, I'm going to dorsiflex your Achilles up. And then using the backside of my hammer, I'm going to hit the backside of the Achilles tendon, looking for a reaction. Okay. I have a slight reaction there, which would be a 2, which is considered normal. Next from here, I am going to be looking and dorsiflexing the foot as well, or again, and I'm going to be looking for slight twitching or anything that might seem abnormal. Okay, here I'm going to dorsiflex your foot. I'm going to let it drop. Okay, that is a normal drop. And something that would be abnormal, I would be looking for slight twitching of the foot, which would be a 2 to 3 little twitches in the foot itself, which would signify clonus on this portion here. Since hers was just a drop without any twitching, that would be a 2 or would be considered normal. So for an abnormal, or in this case for clonus, we would see those twitchings pretty consistently in a row, which also could signify a risk for seizures. In this case, everything is normal, and like I said, it is a 2. Ruby, this is has been your assessment for the deep tendon reflexes today. Do you have any questions for me?
No.
Okay. Are you comfortable?
Yes.
Okay. Perfect. So at this point, I would perform hand hygiene and then step out to document my procedure. Thank you.